COVID-19, how to stay healthy and safe at work. COVID-19 is a disease that is spread via the droplets of saliva of an infected person, but also by touching a surface or an object contaminated by another person, and then touching our face. If you're ill, stay at home and follow your doctor's recommendations. At work, follow all preventive measures, just as in any other public spaces. Employers must reorganize the work environment to avoid the risks of contamination. Arrive and leave separately to avoid gatherings. Organize the traffic flow to prevent people from crossing paths. Make hand gel and disposable hand towels available. Space out and stagger workstations to guarantee at least a meter between people, or install partitions. Ensure a minimum surface area of 4 square meters per employee. Regularly air rooms. When arriving at work, wash your hands and keep doing so frequently throughout the day. Greet your colleagues from a distance and without contact. Make sure you have a space of 4 square meters to get changed, and stay more than 1 meter away from your colleagues during breaks. During the day, cough or sneeze into the crook of your arm or into a tissue. Avoid touching your face. Stay at least 1 meter away from your colleagues and others. Keep your distance, even in cars. 1 person in the front, 1 in the back. Wear a mask if it's impossible to respect the safe distances. Avoid touching objects or surfaces that other people have touched. Don't lend people your things. Avoid contact by not directly passing someone an object. Clean your equipment before and after use. Discuss any issues in changing work habits with your colleagues to find solutions to avoid risks.